like how CA pancreas as a tail was not picked up. Could be out of the radiologist is overstressed. We have very few number of radiologists, workload. So he may have missed out.
True.
So human error is there. But this is where AI comes in.
Yeah.
If that thing is there, it will help pick up something where you will not miss a diagnosis. And see, for that family, and we heard that there were 3 young kids, they lost their father. So I thought AI has a role to play. There's a long way to go. And I think so the basic structure is that now I think so all of us have to start looking at having the full-fledged EMR in all our hospitals, using it diligently. Lot of many places have the EMR, they don't use it. So because this data will finally be monetized also.
Correct. Absolutely. I'd like to ask Mr. Davda, Apollo has got this huge network across the country, and what are the areas of artificial intelligence that you are currently working on using, so that, we are talking to some of the largest groups in the country around this table. What is it that you are working on in terms of enhancing clinical efficiency, clinical effectiveness, both?
I think the most important part for us to really look at Apollo has always been the clinical, and we don't really want to leave that behind. So
right.
On the clinical front is one area that we've been very aggressively looking at it. Some of us think that AI is something which has come only yesterday, but at Apollo we've been working on this for a couple of years now. And going beyond the clinical, we are also looking at a lot of other areas like customer care, even the clinical care as far as the enhanced connected care is concerned. So these are areas which have been always there on top of our mind, and we don't spare them at all. Any area that you get, now it's gone into RCM, revenue cycle management, we've looked at it. We've looked at it into our submission of documents to the insurance companies. So we think technology is going to be there. You can't live without technology in this world. And it's
right.
better that we partner with technology rather than saying that we're going to eliminate doctors from there. It's not going to be possible.
Yep.
It's impossible. So let's partner with technology and move ahead with it is what is the call that we take within the organization. And we're going to continue our efforts to ensure that the investment on technology is going to be higher and higher as we move ahead.
Absolutely. Subhash, over to you. What is Aster DM working on? What excites you about artificial intelligence in healthcare today?
Yeah. So I come from a vertical called Aster Connected Care. What we're doing are 3 projects is one is connecting tele-ICs which are in Tier 2, Tier 3 cities. The other one is the Aster Digital Health app, which is going to be by itself an ecosystem that we are aiming at. And the other one is teleradiology. So I come from all 3 backgrounds. So I echo both of them statements about all the angles that we are looking at. I don't repeat what you already said, but 2 things is one-click protocol is something that we are working on. As Dr. rightly mentioned, we make sure that we increase our efficiency of doctors that instead of documenting a lot of things. For example, if they want to click one click as a code blow, there is a set of all the steps the nurse has to follow. It's always should be popped up on the system itself. At the same time, if they want to create any kind of ICU protocol, shock protocol, whatever it is, we already have them inbuilt with the diagnosis, with the medications, with all those things, with the routes and everything. The moment you click it, there's only 1-2 clicks that will be able to order and treat the whole things. So by that way, it will reduce the time of the doctor and you're able to use it for multiple other patients. And this has been very helpful for us in treating Tier 2, Tier 3 hospital because we are enhancing our number of hospitals across. The other one is connected care about converting most of our beds, creating a protocol like that any patients come from an ICU or an OT, by default they go into a 24/7 continuous monitoring with multiple devices that you can use it. And we have connected that with a complete robust workflow where the notification comes in until we document it. Right? By that way, the number of code blues have been reducing, the quality of care has been increasing, the average length of stay is coming down. So in that way, the patient satisfaction is much more better because there's always someone to go and tell them, okay, we got an alarm, is everything's okay.
Absolutely.
So by that way, it is giving a very good patient satisfaction, the average length of stay, the clinical and commercial both. These are the main reasons that we're working. And the other than is implementation of EMR, where the main documentation has to come from the nurses. That is what we're still working on to make it easiest way to document and for them to adapt it much more.
I think we realized this also way back in 2012 when we were setting up our flagship hospital at Wockhardt. And we realized that till we don't stop treating nurses as clerks and, with the red, blue, green pens with those harmonica-like papers, first of all, that's not very sustainable from a green perspective. And also the fact remains that you're always going to be seeing higher attrition, going higher and higher over the years. So we at that point in time had connected with Philips and launched the ISA or the ICA system, to document things. And now I believe there's an ICA Lite. And I believe what you're talking about is the DOSI thing where we are monitoring. I think we've ourselves seen a lot of advantages in terms of getting this monitoring because we've triggered more RRTs in the last 1 year than we've ever triggered before in the past, and therefore difficult to say without using risk-adjusted mortality and all of that. We are not yet so adept at that as a country, but I believe that there is an opportunity to really showcase this. I want to talk to Dr. Ravindra Babu and ask him that most of the challenges in terms of accepting technology, comes fortunately, unfortunately, from the doctors. The nurses just listen and they kind of go ahead. And I know we have quite a lot of doctors in the room, but let's accept things for what they are. And I believe that the more senior the doctor, it sometimes becomes a little more difficult. Your perspective on this, how have you seen technology, especially related to documentation, wherever it's directly connected to patient care? So other documentation they'll accept, like they'll even begrudgingly fill in your incident reports for quality. But when it comes to patient care, they refuse to believe that agar naadi pe haath nahi rakha hai, to wo pulse hi kya? It sounds like some shairana, kind of thing. But the fact remains that one will have to learn to trust technology. One will have to learn to trust the infiltration of basic physics, chemistry, biology into technology, because I think the IITs, NITs are really doing a great job. So over to you, sir. What do you believe, or how do you believe we can convince doctors to accept these technologies that are going to come, and there are going to be plenty more coming?
That's right. It's a very complex situation when it comes to using technology. Doctors are at the forefront when they have to use this technology for, let's say, performing surgeries, robotic, or do the implants and other things. They're very advanced in those areas. But when you ask them to use technology to transfer it onto the case sheet, they would not. They just don't want to use the computer. On the contrary, the nursing team is much more. It's much easier to get your nursing team on board to adapt, and even they work on most difficult of the softwares and still ensure that it is working. So that is the little difference in how the ground works. And I work at Apollo Hospitals. I just want to mention about how we are using AI. Personally, at my level, when I had to come to this conference, there was a speaker, I have to send my bibliograph or whatever. I just entered my CV, and then immediately it tells, it grasps all the things, and I get that note and I forward it. Also, I use this Copilot, the Microsoft thing. They're lengthy mails, there's so much of information coming, and then you just summarize, and it just, in 5-6, it summarizes things for me. Now I have to reply. I don't want to waste my time writing the whole thing. I just tell, okay, I accept it. However, we need some validation, 3-4 points, and then it brings up such a huge letter. So the AI is already there. I think it's not a future, but it is currently there. We have to, I think, we need to accept and adopt these things. So it's definitely changed the way. Okay. The other thing is we ask for a history physical for a patient summary. What happened to this patient? The doctor gives the entire summary. Now I have to present it to the group. Then I put it again in the AI. It gives me the summary. The beautiful summary flow comes out so that we understand things better. I'm able to present it better. And helps me in managing the time. And the quality also is much superior. That's how it is useful at my personal level.
Okay.
Coming to the hospital, so we had a problem with our radiologists, the number of radiologists. We were struggling with the numbers, and then came an idea, why don't we use AI for X-ray reporting, right? Now my X-ray reporting turnaround time is almost 1 day, 24 hours. You have thousands of X-ray, but a few of the X-rays become very critical. Pneumothorax, fracture rib, or lung contusion, consolidation would be very critical, and I would like to have the report then. Otherwise, nobody would actually remember to go back and look into that, and we generally tend to miss, and it's an error, medical error that happens. So now we have adopted this system where within 1 hour I have the report. In fact, the report is already there. It's just a validation that the doctor is currently doing. I think going forward, even this validation probably may not be required. It will become official that, okay, AI reports is good enough.
Fantastic. I think if you promise not to tell Gaurav that I created my slides for my 4 o'clock presentation on ChatGPT, I promise not to tell Dr. Anupam Sibal that you respond through Copilot. So, yeah, I think that's fine, but I think Hindi में हम कहते हैं ना नकल में भी अकल होनी चाहिए. So I remember an organization where I had gone for an ABH assessment, and that time they were trying to apply natural intelligence, and unfortunately they showed that in the SOPs there was a basement when actually there was none. So these are the sort of faux pas that happens, and unfortunately we've in one of the hospital chains that I worked for, we've actually reported a prostatectomy for a female patient. It's just the way the typos happen. So I think it's one thing to do a mammography for a male. We do that. It's an indicated thing. It happens in the rarest of rare cases. But I think a prostate removal for a lady is a bit much. So I think natural intelligence needs to be applied. Dr. Jyoti, question to you. You deal with consultants, you deal with residents. Do you really see that AI can impact, the turnaround of patients within the system? As you know, one of our biggest problems in healthcare is that of discharging patients well in time. We are never up to the mark on that, probably because we don't have a department of discharge. There is no process owner. But do you really feel that we will actually have tangible gains in terms of better bed availability, better patient satisfaction when it comes to using AI to work with patients?
It's a very good question, sir, and rightly asked. I would say the discharge process is a pain area for every healthcare. With the volumes in healthcare going up, and across, you pick up any hospital and you will see the occupancy high, and the key process which can bring a change over there is the discharge process. The processes are in place, but we all know that a hospital is majorly being run by human resources. Human resources, when you talk about them, the factor of fatigue, exhaustion comes into play. That is where I feel that AI can play an important role if we have got predictive methodology coming in there from all the vital parameters, having studied the EMR, if in use, have been collated, a summary and play an important role over there, the communication to the family, which is again very, very important role which it plays in preparing the family mentally for the discharge process next day. What are things which is required to be kept ready? All these things we can have AI implemented over there to bring in more efficiencies and optimize the processes which are already there in place.
Fantastic. So I love that answer, because it basically tells us that if we decide to let AI do things, I think AI can do it. Rashmi, one, I'd like to hear of an example from Narayana. What exactly, just one, because we're running already a little late, I'm already getting signals from there. An example. And secondly, do you really feel that artificial intelligence used appropriately in healthcare can actually impact patient safety and enhance healthcare quality?
Right. So thank you for asking that question. And since you know that we come from a group where chairman itself is so passionate about the technology,
Absolutely.
so we have complete support on adoption and even developing technology, because we have an in-house company. And coming to that, I think any solution is only when it's successful when it helps the stakeholders, whether it's a patient or a doctor. So I just want to say one example, since you've asked only one, we have so many. But I'll just give you one example which is very helpful for the healthcare provider, and that's how we can increase the adoption, which is called MedhaX. It's a subscriber tool, so which helps, like when you're interacting with the patient, it helps, it generates the consultation summary. Removing, when you're talking to a patient, it's like your normal consultation, you're talking to a patient, and your AI in the background is generating a consultation summary, removing all non essential information and putting your information into a widget which is required. So at the end of the conversation, the patient is not feeling you're using technology or you're not interacting with him, but you're developing a consultation summary which is all appropriate information, put it in proper widget. So that is something which is helpful for the patient and plus the doctors. So I think this scribe or Meta X is used in most of the things, whether it's a diagnostic reporting or whether it's a consultation summary, whether you're creating a progress note. So when you're dictating the progress note, it's putting everything into the widget and reconciling it.
Fantastic.
Yeah. And then like when you say discharge stat is, I think, a very problematic in all the hospital. So in our hospital, we are not worried about the summary, that when the summary is going to come. So as soon as the patient is marked for discharge, your discharge summary is ready because it's pulling all the information from your OT note, from your progress note, from everybody, and then generating a discharge summary. So the patient is marked for discharge and your discharge summary is ready. So
Wow.
patient is discharged with low time.
Fantastic. I think I don't think we need to look at ACHE and Joint Commission and all of that. We have enough in-house resources provided that we as a group, and we've got huge organizations also, right? We've got Hope and Nat Health and FICCI and CII. I think there's just a little need to be a little bit open and say, "Chal bhai, maine aisa kiya hai, tu bhi aaja, tu bhi seekh le." I think that's where we are probably lacking. Collaborate. I think the competitiveness in us sometimes kills us. So I have one kind of question which most people typically get countered with this question of the challenges in adoption of healthcare technology. In random order, what have been your personal challenges in your organizations? I mean, specific instances if you can give so that the others can learn. In a minute, each one of you tell me how did you overcome those challenges? Maybe you can start with Rashmi since she's got the mic up.
Thank you. I think that most of us will have the similar challenges, but I think infrastructure is something which is all of us struggling with. Is whether you have cows or whether you have handheld devices or whether you have a laptop or how many laptops or where you have to place it. So I think infrastructure, getting a right infrastructure in terms of your devices plus your networks plus its availability and it's your EMR tools are not uploading on time and there is no lag. So if you have all these things, I think then
so interesting. You said Dr. Devi Shetty. We all know him well. We respect him a lot. You said Dr. Devi Shetty himself is a tech tycoon in his mind, and that's the way he thinks. So, question: how did you convince him to give all the money?
We show him result.
So that's what. How do you guys all?
To be explained to the people who will be using it. To start adopting it, because I'm giving a personal example. 2009 to 11, I was in charge of the Max rollout for the EMR.
Right.
And it took a lot of effort to get things done, and so that helped. And to the other point on the ROI, because me and Sanjeev Mari used to be on the not on the Max board, but used to be permanent invitees. So it was a hell of a thing to get the board convinced, because that time it was 108 crores, if I recollect. 2008 when we went to the board, 2009 we started the exercise, 2011 we had taken the Del Perro, the open system. And all these things were told that because of this, it's a costly thing, but it will be spread out over so many years. And the advantage is that all the data will be there. And data can be monetized also later on. And why are we in healthcare? To see that the patient gets the best outcome. The patient and the relatives have the best satisfaction. So if you have this data, the treatment that you are meting out are the best. I'm giving an example. There's so many joints. Now, after 10 years or 15 years, if you have all the data, which implant is the best.
Absolutely.
But otherwise, if you don't have that data in, it is your versus my word. That's all.
Absolutely. Yeah, I love this thing that you asked, that we have to explain the why. I think what's also very, very pertinent is that, when we are posed by, when the stakeholders put up this question as to why do I need, let's say, an automated monitoring of vitals, or why do I need an automated system in the OT to look at anesthesia, deviations and this and that. I think the question that administrators need to rightly put up to them is why not? And I think that's one thing that we will have to learn for all technology. We'll have to accept that today is not the day to ask why. My daughter taught me this, because when she wanted to buy the latest iPhone, my son is in the Android space and my daughter is in the Apple space. So she only asked me, and I said, but why do you want to buy it? So she looked at me and said, why not? You have the money, I have the inclination, let's find the time. So I think it's extremely pertinent for us to be able to articulate the question, why not? Why not? Why are you not willing to try out an automated monitoring? So promptly the answer comes back, the patient has to pay. Today there is an opportunity for us to monetize this and ensure that insurance pays, because there is a clear cut, wherever we've used artificial intelligence, wherever we've used technology, we've seen better outcomes. I think this calls for a nationwide study across various groups to try and see how technology is actually impacting. I, for one, though we're a relatively small group of hospitals, I, for one, would be happy to sign up for any such initiative that happens. Now, I know we'll all try to grab the lead and say, nahi, humne pehle publish kiya, nahi, unhone nahi, humne kiya. I think it's time to rise above that and actually, like for one paper that's required, Rashmi, is how accreditation is actually impacting healthcare quality. Another paper is how is artificial intelligence actually impacting resource management. Subhash, over to you. Your views on this. How do you think, what are the challenges that you faced at Aster or within your specific company within Aster?
I was expecting some of them will mention about legal and data security.
Okay.
For me, that has been a huge challenge for us, because the moment we bring in any of the technology into the ecosystem, our tech team is being extra cautious. So we do a lot of checks and balances before we get. That's one of the challenges. The second challenge is about legal. With whatever DPDP Act that's been, I don't know if there is a lot of understanding and all those things, but for us getting consent with the patients for each and everything that you do minute things. Two things in that is it will make patients unnecessary tension over, like you're putting a lot of concerns and we need to explain them to understand what is the do's and don'ts of it. So I felt those are the two things, but other than that, the implementation and the challenges of the management, as you rightly asked, why can't we do it? Because everyone today wants AA to be help them, but no one wants to put data into that. So if I want LUV data to come out of AA, if I don't put in the data through my last person on the pyramid is not putting data into that, I don't get. So these are the main three challenges that we are facing.
Dr. Jyoti?
So I feel, sir, wherever doctors' skills get enhanced, they want to go for those technology. For example, use of robotics. We have installed Gamma Knife radio surgery, which is doing minimal invasive surgeries, MR Linac. So they push for it. They push for these updated technologies. But the challenge which I feel is the training. We have simulations available now, but training of large forces, junior resources comes as a challenge, which over the period of time, by volume and experience, we mitigate that.
Okay. I think here we'll have to be like a strict parent with a truant child, that Xbox पे खेल लो लेकिन साथ में homework भी करना पड़ेगा. I think that's the way we'll have to look at. Dr. Ravinder sir.
I think your question was what are the most critical things for proper adoption of the technology. I think software is something which is important. The quality of the software has to be really good. Second is it should be flexible and adaptable. We need to customize to the consultant requirement, and also the hardware has to be really good enough and it should be available in good numbers if it has to be adopted. Coming back to your the question about discharge summaries and right, we are what we have done is one is a predictive discharges, right? So we get a list of floor-wise, which are the patients likely to be discharged. It's going to live, and it is trust me, it is about 80%, right? A TKR is expected based on his condition is expected. So the predicted discharge is one thing. Second thing is there is a discharge format which actually comes and sits there. For example, I've done a surgery, a TKR, I've done a brain surgery, trauma. There's a format that's coming. If you already have done your surgical notes and diagnosis, that all is picked up in a nice way and it comes there. And these days, it was very surprising for me. I see doctors walking down the ramp, and he was talking on the phone. I just was curious to understand what was he trying to do. He was dictating the summary to the phone, and he's just saving his, completing his job while on the walk. So that is there. And lastly, coming to this our enhanced care, right? You said in the monitor currently what we are doing is we set the range, upper range and the lower range, and we tell the monitor to tell whether you tell us when it's abnormal. So it may give an isolated data, tachycardia, bradycardia, respiratory rate more high. But when the AI gets into that, it gives a sense that when there's a combination of factors which are affecting the patient, it gives a better sense of what is happening to the patient. I think that is where the artificial intelligence has much more superior value in understanding the patient condition, and very unlikely that we're going to miss those signals.
So I just want to wind up with these two questions, or rather one question. We've all heard of different forms of AI-based patient monitoring systems, etc., etc. Now, your views about AI-based patient monitoring systems, and more importantly, how do you feel that India is actually faring in terms of the adoption of such technology? To be very candid myself, we, for example, it's a pass-over cost to the patient, so we don't really, there's no cost to us, but we found tremendous advantage in terms of saving lives. So I'd like to hear from a few of you, all of you, whether if you've experienced AI-based patient monitoring, how has it actually been, whether it's been useful? Because most of the problems that I face from my consultant is, अरे नर्स को बोला था देखने को हर 2 घंटे के बाद, ये फलाना चालू था, ये दवाई चालू था, ढिमकाना चालू था, नर्स ने देखा नहीं. यार नर्स को बेचारे को मार डालो बच्चे को यार. It doesn't work like that. At the end of the day, we'll have to give certain tools, you want your robot, why not give the nurse her automation as well? Sorry, I don't want to be misogynistic. So your views on how AI-based patient monitoring is catching up in the country, your views on the future, whether it's going to pick up in a big way. I know for a fact that All Indian Institute of Medical Sciences is actually going to take this up as a huge pilot across all aims. And if that happens, well, at least we know that the next generation of doctors is definitely going to come out asking for this. I think we need to sow the seeds early, like we're trying to sow the seeds of healthcare quality with a second-year course in healthcare quality across all colleges. Your views on AI-based monitoring devices?
Yeah, as I mentioned earlier, AI-based as 3 complete results as we did a larger group of POC for us before we implemented in our hospital. Top 3 are, one, as I told you, the reduction of number of code flows in non-critical care areas. That's a huge, that has multiple both commercial as well as clinical benefits by itself. Second thing is about nurses documentation, reducing nurses documentation time, making a clear documentation of it. Every time, if it's a 1:6, 1:7, 1:5 ratio of nurses in any hospital that's given point of time, for them to walk in each and every hospital, get this get the documentation done. We also know that on realistic, they don't check every time because of lack of time and other works they do. So the proper documentation, and nurses are so happy that way that, as you rightly mentioned, the attrition has come down so much, and they're happy about it because by AI-enabled, they're getting accurate alerts, and there is always a team as a rapid response team from a command center which will be their help. Because earlier what happened, the ward nurses has to find out, go check by herself, then call someone and come for an help. But now with an AI-enabled, it's a command center and hub and spoke model, all of a sudden the alarm is reaching all the right people at the right time. The rapid response team is always there to help. So by that way, it is helping nursing efficiency. And other is the customer satisfaction. So because of all these 2 results, the customer is so happy because everyone is monitoring my patients, or our relative who's there in the hospital 24/7, and it's helping them on all 360 degree.
Yep.
And it's going to be there, but everyone has to adapt today or tomorrow. It has to be.
Dr. Panigrahi, sir?
It's an important thing that we're facing now. If you look at it, most of the chronic care will go home, go out of the hospital. A lot of the hospitals will start looking at acute care. This is where the critical care beds are going to come up. If you recall, I remember when I was doing my MD in the 80-81, that time, it was that 10% of a bed, hospital beds will be ITU beds. The British book was ITU or ICU. No hospital has less than 30%.
Correct.
Some of the hospitals have 50% plus also. So that is the challenge, that getting the foot soldiers there, I'm talking about the nurses and the junior doctors there who are in front of the patient. This is where AI will come into play. The most important, if I can put it, in the critical care, say in the ICUs, and this is where it will come in. I'm giving a small example. So a VP this happened. So it immediately sort of give a prompt, please check the potassium.
Right.
Because a VT-VF doesn't happen all of a sudden. There's certain
There are precursors.
So these are things I'm saying. So I think so these are the things that will help out. And because we are not going to have nurses are few and far in between. The junior doctors also are not that. So to see that support a critical care setup, whether it's the private sector or public sector, whatever it is, AI is going to play a major role there.
Mr. Davda.
I don't want to repeat what my other panelists really spoke about, but then one area that we could really avoid complications is on the legal front. You have everything documented. People can't document it in the sense electronically documented. Not that you've fudged the records or you've written something down. People come and complain this regularly saying that, no, my family member was not taken care. The nurse did not come for the last 8 hours. They didn't see them. You have all the records there. So this is one area that the hospitals really look at it saying, I think the number of legal cases that we would really look at called the so-called medical legal cases of medical negligence can be reduced to a large extent.
Okay. I think, there are those two ladies behind who are all ready to throw stones at me, and before I get pelted in public and reminded that I have to remind myself in India and not in KSA. The point being, ladies and gentlemen, that I'm trying to wind up here in case you didn't get the joke. The point being, ladies and gentlemen, that artificial intelligence is here to stay. Whether it's in your kid's phone, whether it's in your husband's phone prompting him to buy you a gift 2 days prior to your anniversary, or whether it is going to be alerting you to ECG changes, temperature changes, pressure drops in the ICUs, in the wards, etc. We all know that there is also a whole set of variables that are available. We give them to a lot of patients, especially those who are on cardiac drugs. We give those to them. It's there. The question is not why are we, like the question has to be, why are we not adopting these fast enough? National accreditation did for India in 10 years what Joint Commission took 60 years to achieve. Okay. And I hope that my good friend Nick is not here from JCI. Otherwise, I'll never ever get to a proper survey. But the point is that we've always been quicker, smarter, better to achieve. And I was listening to our Niti Aayog gentleman upstairs, and he said, the Prime Minister said that the aim is to have e-enabled healthcare so that healthcare quality is enhanced. So let's not allow thought barriers to come between us and adoption of correct technology. Let's adopt the technology, give it a try. I'm sure every company who has the technology is willing to do a proof of concept with you. But once that proof of concept is proven, let's look at the larger picture. We need a healthier India. We need a enabled India. We need an India that's got to rise from position 5 to position 1. And before we get quote unquote trumped at it, let's focus and get our country faster, better, in healthy shape so that we are able to really become the healthcare cradle of the world. With that, I thank all my panelists. Thank you very much for your time. Beautiful answers, excellent focused answers. And I'd like to thank all of you for being a very intelligent and a very an audience with an excellent sense of humor. Thank you very much, ladies and gentlemen. Thank you, esteemed panelists.
Thank you.
Yes, please.
Thank you for this wonderful session. Can I request our moderator Parag, Rindani sir, and then all the speaker for a group photograph?
वो भी अभी ले रहे हैं 2-4 साल के बाद वो भी AI enabled हो जाएगा. Thank you very much.
Thank you.
Thank you so much, sir.
Thank you, sir. Thank you. Thank you.
Wonderful meeting.
Thank you so much. Pleasure meeting you.
Same.
Thank you, Rashmi. Thank you, ma'am. मिलते हैं. आते हैं फिर हमारे कभी.
Thank you. Nice meeting you.
Thank you, sir.
Thank you very much. Well moderated.
Thank you.
Sir, lovely hearing you.